What's up, everybody? Welcome to the RT Clinic. Today's video is about the in-check dial. You need to know it if you're a clinician or if you're a patient taking any type of inhaler, dry powder, MDI, turbohaler. You need to know about this device because it lets you know if you're getting the right amount of medication or if you're getting any medication at all. So are you ready? Let's go. This device called the in-check dial, it comes in a plastic container, and on this side, this is a little bit of an older one, but on this side it tells you about the flow rates that are required for all of these different types of devices. Now this is a little older, there's some new inhalers out there on the market, but this is going to make sure that you're in this green zone when you take your breath in to take the medication in, because there's nothing worse than talking to your patient and them telling you, I've been taking this inhaler for a while and I don't feel like it's doing anything. Or the doctor put me on this a year ago and I've just been doing it, but I don't think it does anything. First thing we need to find out is it actually getting to their lungs? And that's what the in-check dial does. So I'm going to open it up a little bit here, kind of show you how it works. Inside this device, you're going to see three different pieces in there. There is a little magnet on the top. There's a red indicator, and then there's a white disc right here. So that's actually going to help to tell the clinician how much flow you're taking in, and we're going to measure it on this scale right here, as you can see. So if you look on the front of the device, there's going to be multiple different aspects to it. You're going to see, first of all, this looks like open flow, and we can actually look, and when we adjust that with the arrow adjust, you can see it's a large flow through there. And then as we go to different inhalers, you can see here, this is a 4-adil inhaler. You can see that, and the orifice gets much smaller. The resistance inside of this is going to mimic what's inside of the inhaler. Because if you've taken inhalers before, either MDIs or dry powders, you know that they're all going to have a different amount of resistance. Now, who has taken care of a patient before, back when we used to give a lot of Advair discus, and you go to open that Advair up and it like cracks and pops when you go to open it. Even the patients know that. What that means is they've been rupturing those little powder canisters in there, those little powder capsules in there, and they're not inhaling it all because it takes so much flow to get, at least 40 liters per minute. Well, 40 liters per minute is one thing, but if you're actually pulling it through the orifice, it's even harder. That's why this in-check device is so important when prescribing or giving a patient a medication or teaching about their medication, because you need to know right off the bat is, can they even get the medication out of the device to get it to their lungs? So, other things you can look at here, as we look down the center here, we have the discus, of course, right there, lined up with that part. We have an inhaler. So this is actually an inhaler, a lot less resistance you see with the inhaler, much bigger. And then I think this is a turbohaler, if you have these turbohalers. And so a little more resistance with that. So the way that you would do this, and the cool thing about this, is we actually can use it between multiple patients because we put a one-way valve on it. So they're only taking air in, never blowing air out. The one-way valves we have look something like this. These are pretty inexpensive also. And they have an airflow direction on them. You can see it right there. You want to make sure the airflow direction is facing at the patient or at the patient that way. So we're going to put this on. It fits perfectly into here. First thing we're going to do is to teach our patient how to take a slow breath. And so we're going to put it on this one, the wide open, the smooth one here, and we're going to teach them that laminar flow. Now, if you don't know what laminar is, that's the medical term, or no, not really medical, I guess it's any type of scientific term for smooth. So smooth flow is really important, especially when it comes to MDIs, because a lot of patients either they have bad MDI technique or they take it in very quickly, like that. very quickly. You've seen it done on all the movies and all the TV shows. They puff it really fast. That's absolutely the wrong way to go. You're supposed to have a smooth flow all the way in. Think about this. It has to get the medication, for it to even work where it needs to go, has to be 3 to 5 microns in size. Has to get to the very bottom of your airway. So 3 to 5 microns is super small, right? Anything else that does not get to the lower airways is absolutely wasted. So anything that splatters in your mouth, on your tongue, in your throat, in your trachea, in your main bronchi, in your segments of your lungs, anything like that, where it's going to deposit and not get down to the lower airways is absolutely wasted. And then you know what you get? You actually get side effects from that without the positive effects of opening your lungs up. So that smooth flow is really important. And what we do, we really try to teach people when they're taking their breath in, to fully exhale, seal your lips on, and take a smooth flow in. And the goal is to hold for 10 seconds. And if you can hold for 10 seconds, what that's going to do with the medication, allow it to deposit and then have a slow exhalation. So if you're ordered on 2 puffs, you'll do 1 puff like that. Usually wait 30 seconds or so. Fully exhale, seal your lips, puff the device, and then take the slow breath in. And that's what's really important. Now let me see what I can do with the InCheck device when I do that. So a couple of things that we do with this. First of all, you got to knock it all the way to the bottom. So you pop once, and then you bring it back, and you bring it back. So it goes down, and then you bring the little weight back, okay? Now we're all the way at the bottom, as you can see, so we're ready to go. Arrow facing the patient, okay? I've got it on wide open, so I'm going to take my breath in and I'm going to see what kind of smooth flow I can get. And the goal is to keep it really, really low and not bring it up at all. So, even with that, I pulled a little bit too much. It's kind of in the middle of the inhaler, as you can see on the bottom. I'm right at the top edge, okay, so it didn't look like much, but actually I pulled in quite a bit there. That's because it's wide open. Now if I go over to the inhaler, so I will, meter dose inhaler, HFA inhaler, no more CFCs, man, don't remember that stuff, but we got HFA inhalers. So I'm going to get it ready. I'm going to show you what I can do when I'm pulling through the inhaler. Ready, full exhalation, seal. Alright, so that one I was a little bit high even that time, almost a little bit fast, as you can see here. I don't like that, right? That's not good. So I would have to, it's really good for training your patients or train yourself because you can concentrate on going even slower. Here's the problem. What do you have a rescue inhaler for? Rescue when you're short of breath. So if you don't practice this breathing technique when you're feeling fine, it's going to be really hard to do when you're short of breath. So concentrating on that slow flow is really important. And you know what? There is a point that it comes that maybe a meter dose inhaler is not for you. Maybe you need to go to a nebulizer of some type. They have nebulizers online now. Actually, I was looking at one. We have one here that I can show you. This is just one that we use sometimes. This is a portable one. It actually charges with a USB. It has vibrating mesh inside of it. It probably doesn't work as good as the nebulizer that comes out that we use from compressed air, but it works pretty well because it nebulizes the medication so you can inhale it in, runs off AA batteries. You can find these things on Amazon right now. So maybe it's not good for you to take an inhaler. Maybe you need some liquid albuterol or a liquid rescue type of medication because you either take your breath in too fast or too slow. Well, let's look at this case. So the next one is, let's go back to the Advair discus, and it takes quite a bit of flow to do that. So I'm going to go and change this part discus to here. So it changed it to that small. I'm going to pop it down, pull the weight back. Now I'm going to take my breath in. See if I can do it. Now I need to pull at least 30 for this. So I put a little extra oomph in that one just there at the end. So I was able to get about 70, but I gotta have healthy lungs. How many times have you seen a patient before that you give them their Advair or whatever, if they're discus, and they do this? You know, that's barely even getting 30, as you can see there, and that's not even enough to even get the medication out. So it's really important for what other medication that you know what your flow is. Now look at this. This is one that's really cool. So this Spinhaler, I believe it's from Fordale, and I love Fordale. I think it's a really good medication. It's a little bit of fast, a little bit of long acting. I think it's good. But you know those blue inhalers, and I don't have one to demo here, but actually put the tablet in and you crush it and you take your breath in and it spins. And I mean, it's an old medication, but it's an oldie but a goodie for sure. I'm a big fan of Fordale. So it's actually really high on this list. This is that Spinhaler. So you have to pull some crazy speeds for that. So to be able to do that, we'd fully exhale. I'm going to turn it over to that because I believe, yeah, there we go. I'm going to see if I can pull it 60 to 90 liters per minute. Man, I really had to tug on it. I got about 90, maybe we got 95. So, but I pulled really, really hard. I don't think a lot of our older, especially patients that are compromised, would be able to do that. So that Spinhaler is a really hard one to be able to get the full amount on. I think this one is really good. Specifically, if you're going to touch the most patients, you're going to want to use this wide open one, and you're going to teach them that with their standard flow for an inhaler. One of the things I'd love to do is to give a patient their inhaler and ask them how they do it. Now, we're not even taking into account the spacer devices. Now, that's really key, and I believe I have other videos on that, but that's really important for holding that medication there and getting the timing correct. But you have that aspect of it, and then you have the flow aspect of it that all changes the deposition of the medication. And so training your patients on this is really, really important, and being a patient that is trained on one of these in the doctor's office is really important also, because maybe you think your medication isn't working and maybe it isn't because it's not getting to where it needs to be. Just remember those flows with your MDIs, they need to be really slow and smooth. 10-second hold and then a slow exhalation. Now try to do it when you're feeling a little short of breath. It's difficult, but you need to train yourself to do it. If not, your medication is not going to work the way it should. So just demoing today this InCheck device. This is really cool. Something that you really should have in doctor's offices. I'm not being paid by these guys or anything, but I just think it's really important that if we're going to give a patient medication, that we know that they actually can get the medication to where it needs to go. Because if it can't get to where it goes, they're just pretty much throwing money out the window. And nobody wants to do that right now especially. So it's really important to make sure the patients are taking the proper flow for the type of device that they have. Now the new InCheck devices have a myriad of different inhalers on there because there's so many of them now. Everybody, different medications making a different type of inhaler. So, but the InCheck devices are able to do that. So if you think your medication is not working, ask your doctor. Am I taking the right amount of flow? Ask your respiratory therapist, ask your nurse, am I taking the right amount of flow for the medication that you gave me or the inhaler you gave me? And then the next thing is, if you have a meter dose inhaler, you have to use a holding chamber or an aero chamber, something to hold the medication, because if not, you are definitely not getting the medication that you need. So you're not getting it there because it's splattering or your timing is off. The spacer actually takes the whole timing aspect out of it, because you can puff it and then put it in your mouth and then breathe it in. Or maybe you're not doing the right amount of flow. Those two things are really key for your medication to get to where it needs to be in your lungs. Thanks for watching. I appreciate y'all. Hey, if you give me a second, just reach down below over here and give me a subscribe. I've got lots of people to watch, not a lot of subscribers. And if you're also interested, I do have the special one-of-a-kind RT Clinic Badge Buddy right here. It's available for sale on Etsy. I have them actually pretty cheap. And It specifically looks at, now this was good for a respiratory therapist, a nurse, or a physician, specifically looks all ventilation on one side and all oxygenation on the other side. And we have our curve on here, which is super nice. I don't know of a lot of other ones that have curves on them. And this is special from the RT clinic. It comes in handy a lot if you're reading blood gases and you're doing any kind of ventilatory changes. It's nice to have this around, especially if you're a student or a gift for a student. And thanks for watching. I will see you later.